This month, indigenous leaders have had a lot to say about actions taken by the federal government. Trudeau's recent address to the Assembly of First Nations resulted in praise, criticism, and calls for patience. One of the issues that's been discussed most is healthcare, and with good reason. There are major gaps in health status between indigenous and non-indigenous people in Canada. This fact cannot be denied. Recent reports have drawn attention to the substandard care available in many remote First Nations communities where such inequality exists. There are bound to be serious consequences. Today, amongst indigenous people, the rates of many diseases are far above Canadian averages. When it comes to improving overall health on First Nations, lowering these numbers should be one of the government's major priorities. In this video, we'll look at 5 diseases that are having a negative impact on the health of indigenous peoples, focusing specifically on remote First Nations communities. We'll consider whether the federal government is asking the right questions. So let's go to the video. Number 1. Diabetes. Diabetes is on the rise in communities across Canada, but First Nations are being hit particularly hard. Expert Dr. Stuart Harris described the disease rate of increase in the indigenous population as horrendously high. Harris notes that up to 40% of adults living on First Nations reserves have been conditioned. In these communities, obesity is common. Nutritious food is frequently unaffordable, and poverty is very often a fact of life. These factors are closely related and significant. Consider this: 57% of Canadians admit that they don't adhere to prescribed self-care plans due to the high cost involved. Medications and other diabetes management supplies can be expensive. In communities where poverty levels are high, financial burden can be an obstacle to appropriate self-care. That is, when access to health services is sufficient to lead to diagnosis in the first place. But what about prevention? The Federal Aboriginal Diabetes Initiative is an ongoing program that focuses largely on education. Unfortunately, while preventative education is crucial, current diabetes rates are clearly indicate that there's a lot more work to be done. Number 2. Heart disease. According to the Heart Research Institute, indigenous people are twice as likely to get cardiovascular disease than non-indigenous Canadians. Not only that, but First Nation and Inuit patients generally have heart attacks earlier in life. Many of the factors that contribute to diabetes can also cause heart disease, and the two often occur together. Patients with both diseases frequently require more health care, including services that may not have access to in the community. They may also need to adhere to complicated self-care plans, which can lead to additional challenges. This is yet another reason to focus on prevention. One contributing factor for many people with heart disease is smoking. Research shows that smoking rates, like heart disease rates, are about twice as high in First Nation communities. Clearly, developing programs that provide education and support for smoking cessation and other healthy lifestyle choices has the potential to improve health on First Nations. Of course, there are challenges. Various social factors help determine whether a person will succeed to make healthy decisions. Remoteness is one factor. Setting up sustainable programs in Communities that exist far away from the city centers can be difficult. Number 3. Cancer. A recent study indicates that First Nations have lower 5-year cancer survival rates than other communities in Canada. This finding applies to 14 of the 15 most common forms of cancer. Once again, prevention is important, but survival rates often relate to quality of treatment and how late diagnosis occurs. So what can we take away from a large survival rate discrepancy? The results of the study, which was published in Cancer Epidemiology, Biomarkers and Prevention, raise many questions but provide few answers. Number 4. Infectious diseases. The recent death of 5-year-old Brody Meekins made a lot of headlines. In Sandy Lake First Nation, the boy received treatment that failed to save his life. He succumbed to strep throat, an infection that's easily treatable with antibiotics in most of the developed world. Stories involving the spread and improper treatment of infectious diseases in First Nations communities aren't hard to find. And for every story, there are sobering statistics. For example, the rate of tuberculosis among First Nations people is 5 times higher than the national average, and it's 50 times higher among the Inuit population. In recent years, the international spotlight has also highlighted the growing prevalence of HIV on reserves. HIV rates are 11 times higher on Saskatchewan First Nations than they are in Canada generally. Factors such as socio-economic status, living conditions, and access to treatment and diagnostic services all impact the spread of infectious diseases. Justin Trudeau has verbally recognized these factors as well as a host of others as they relate to health on First Nations. He has acknowledged the ways in which history continues to perpetuate inequality and create daunting challenges, many of which are health related. In this video, we discussed about 4 diseases impacting health on First Nations in Canada. If you got this video helpful, please give a thumbs up to the video. Don't forget to share this with your friends. Subscribe the channel for more important videos like this. Thanks for watching.